My name is Dr. Sree Prathap. I'm a consultant psychiatrist with more than 20 years of experience in clinical psychiatry. I have worked in the United Kingdom for 15 years, and for the last 5 years, I've been working in India, and I'm the medical director of Shadithya Psychiatric Hospital, which is based in Chennai. So I've been working in Chennai for the last 5 years. And the topic that I would like to discuss today is depression. We need to know the difference between depressed mood and depressive disorder. Most of us feel sad or miserable at times, but we can come out of those low mood or miserable feeling after a few minutes or few hours. But when someone has got depressive disorder, this low mood or miserable feeling will persist for a long period of time, and it usually lasts for several days to weeks. So if that depressed feeling lasts for more than 2 weeks, and if it is persistent throughout those 2 weeks, then we call it as a depressive disorder that needs treatment. On top of that, if you wanted to call something as a depressive disorder, a disorder is something that can interfere with our day-to-day life. So even if people have low mood, we can perform our daily activities. But if you have a depressive disorder, then you will not be able to function on a day-to-day basis. So people may have difficulty in studying, people may have difficulty in performing work at the work environment, people may not be able to do the household chores. So if it starts affecting their general day-to-day life, then we call it as depressive disorder. So I wanted to clarify what is a low mood and what is a depressive disorder. So if someone has got clinical depression that needs treatment, then they should have persistently low mood, at least for a period of 2 weeks, and it should also affect their day-to-day functioning. Now, depression can affect people of all age group. It can also affect both males as well as female. Both gender are affected, but females are more affected than men. Let's look at the symptoms of depressive disorder. The first and foremost symptom that I wanted to mention is persistent low mood lasting for more than 2 weeks. I have discussed this already. The next important symptom of depression is lack of interest in everything. People may slowly lose interest in different activities that they used to enjoy. For example, say someone is very interested in watching movie, they'll stop doing that. Someone would be interested to go to a gym, but they stop doing that. So you start losing interest in activities. So you don't feel like having any interest at all. That is a second important common symptom of depression. And they will not be able to enjoy their life. They say, I don't enjoy anything at all. I don't even enjoy eating my food. I don't even enjoy talking to other people. So this lack of interest is a next important feature of depression. The third important feature is low energy levels. So people will feel very tired and they wanted to lie in their bed all the time. They say, I feel very tired, doctor. I'm not able to do any work. I just feel like lying in my bed all the time. So the energy levels will be quite low. Sometimes they don't know whether they have any physical disorders which is making them feel tired. But it's because of depression, they feel very low. The energy levels can go down. These are called as the three symptoms I mentioned. That's low mood, lack of interest in everything, low energy levels. These are the predominant most important signs of depression. Other than that, we have a huge range of symptoms which can be discussed. One is disturbances in their biological functions, which is sleep. Sleep can be disrupted. They may not be able to sleep for 7 to 8 hours in a night. They may have difficulty initiating sleep, or even if they sleep, they will not have deep sleep. They don't feel fresh in the mornings. Sometimes they wake up early in the morning and they cannot go back to sleep. So sleep pattern can be disrupted. Next is appetite. People may either lose their appetite, therefore they lose their weight. In some cases, they may also have more appetite, or they may do binge eating, eating a lot of chocolates, ice creams, eating large amounts of food. So either ways, both can happen. Then loss of sexual drive will be there. Then the third important cluster is poor concentration. People may not be able to focus on their tasks. So they often say, "Doctor, my memory is gone. I'm not able to remember things as I used to before. My concentration is very poor. My work performance has gone down." So these are all symptoms of depression. If their concentration will be affected, their memory will be affected. So people sometimes think, do I have some problem in my brain? Do I have to do some brain scan and find out what is happening? But they don't realize that these are all part of depressive disorder. Next entity is emotional symptoms. So when people have emotional symptoms, their confidence level will be quite low. Their self-esteem will also be quite low. They may have a lot of negative thoughts about themselves and about life in general, and also about future. For example, they may feel helpless. They may feel hopeless about the future. They may feel worthless about themselves. So these kind of negative thoughts, they can ruminate and it can affect them. And in some cases, they may get suicidal thoughts and also thoughts of self-harm. So in severe depression, people may have recurrent self-harming thoughts and they may try to harm themselves. Unfortunately, sometimes they may also commit suicide. So these are all important symptoms of depressive disorder. Next, we'll see what are the causes. Why depression occurs and what are the reasons for someone to develop depressive disorder. Depressive disorder is a very complicated entity. It is not easy for us to pinpoint one particular reason and say that this is the reason for depression. The first and foremost factor that I wanted to talk about is stressful life events. If people have many stressful life events affecting them at the same time, then this can bring down their mental strength and mental ability, and they may start feeling depressed. I'll give an example. Say someone has lost their job recently. Then the loss of a job is a stressful event. Subsequently, they may have financial problems. That could be an adding factor. Then on top of this, say they had a very bad relationship issue with their wife or their partner, leading to relationship breakdown. So when stressful life events combine together and pull them down, not all of them are resilient to overcome the problem. So some of them have poor resilience skills and they may go on to develop depression. This is one of the main reasons for depression. So these are caused due to external factors which are coming from outside, which can make somebody feel depressed. But there are also some internal factors which can make you feel depressed. The first and foremost among this is chemical imbalance inside the brain. We have a lot of chemicals inside the brain. There is a chemical called serotonin. When the levels of serotonin goes down inside the brain, then people can develop symptoms of depression. This is a very, very common reason for someone developing depression. Often my patients ask me, "Doctor, I'm actually fine. I don't have any stressful life event. I'm doing reasonably well. Everything is fine in my life. But I really don't know why I'm feeling depressed." The reason is because of the internal factors. It's possible that their chemical imbalance inside the brain has gone down. The other important internal factor is genes. Depression also tends to run in families. So if there is a strong family history, say a mother or grandmother, grandparents, father, grandparents, extended family members, if anyone had depressive disorder, then the chances of you developing depression is high compared to general population. So it tends to run in families. Now we come to know that many disorders in the world, okay, have a genetic basis, and it can run in families. Say for example diabetes, which many people know. Similarly, we also come to know that depression very commonly tends to run in families. So I often ask people, do you have anyone in your family who have mental health illness or depression? Often, trust me, the answer is yes. When they start thinking about it, they say, yeah, this person has got depression, this person was not okay, those kind of things. So these are all internal factors. On top of that, sometimes when people have physical health problems which are not addressed, then that can also lead to depression. For example, say you have low thyroid levels. So thyroid is one particular hormone which is in the neck region. If the levels of the thyroid hormone goes down, then people can develop symptoms of depression. Similarly, when you become anemic, when the hemoglobin level goes down, again you start feeling very tired, and you also start feeling depressed. Vitamin D is very important. So vitamin D levels goes down, again people may develop symptoms of depression. So there are a number of different physical causes, reasons which can also precipitate depression. Now in the earlier part of my conversation, I did mention about women developing symptoms more often than men. This is because women go through different phases in life where they are more prone to develop depression, and in these phases hormonal changes happens more often in women. For example, at the time of puberty, hormonal changes occurs in women, and that's a vulnerable period for someone to develop depression. Next is post-delivery, after childbirth, again a lot of hormonal changes happens, and that can precipitate depression. The third important feature is menopause. During menopausal period, again people can develop symptoms of depression due to big level of hormonal changes as well as physical changes in the body. Okay. So that's why women are more prone to depression. Now let's look at the last 2 or 3 important topics. Are there any tested diagnosed depression? At the moment, we do not have any specific tests to diagnose depression. It's usually diagnosed based on the history given by the patient and the symptoms which reported by the patient, and observations made by the family members or friends who live with them. And they are also assessed by the doctor, and based on our experience, we make the diagnosis of depression. However, we also tend to do some blood tests to rule out some medical causes for depression. And also, if we want to start them on medication, we have to do some basic screening tests. In some cases, when patients are extremely concerned, we also do a brain scan just to rule out any medical problems in their brain. The last part of the discussion would be the treatment options. So in terms of treatment options, we divide them into a mild level of depression, a moderate level of depression, and a severe level of depression. Now, in cases of mild depression, where depression is caused mostly by external factors, counseling would really help. A lot of people don't know how to resolve their problems. They may struggle with their problem-solving abilities. In such situations, problem-based counseling alone would help. And that's for mild cases of depression. Now, next step is moderate level of depression. In moderate level of depression, they may have a number of different symptoms that I mentioned before. So in those cases, combining medicines as well as talking treatments would really help. Okay. So people often think I won't take medicines at all, but it's not the case. Your depression could be due to chemical imbalance inside the brain that needs to be corrected. So therefore, we give medications which can correct the chemical imbalance inside the brain. On top of that, they also receive talking treatments which would help them to face their problems, which will help them to face all the emotional symptoms of depression and really come out of it. The talking treatments are basically called CBT, also called as cognitive behavioral therapy. In some places, they do a very structured CBT sessions, but in some cases, they do it on a low structured level. The third important type is the more severe forms of depression. If the depression is severe, that means they have very higher number of symptoms, and the symptoms are more severe in nature. In those cases, most often they need antidepressant medications. So we have to treat them with medication. And once the symptoms improve significantly, then we can provide additionally counseling and also talking treatments. In some rare cases, when people have severe suicidal thoughts, recurrent suicidal thoughts and ideations that are not responding to medication, then we treat them with another treatment called as ECT, also called as electroconvulsive therapy. Now, you need to know 2 or 3 points about antidepressant medications. Antidepressant medications are given by doctors. Often the patients have a doubt whether they are addictive in nature. Antidepressant medications are not addictive, and they can be taken in the long term, like 6 months, 1 year or 2 years. No problem at all. Number 2, the antidepressant medications work slowly. People think that after taking a pill, their mood should lift. That's not the case. Usually it takes 3 or 4 weeks for you to notice improvement. It actually takes 2 to 3 months to notice considerable amount of improvement with antidepressant medication. And following improvement, we suggest people to take medications for 6 months to 1 year. Most of the antidepressants in the market have very minimal side effects these days, okay, which patients can easily tolerate, or they may not feel any side effects at all. So if you see a doctor and you discuss the medication, they'll be able to provide good medications with minimal side effects or have no side effects at all. And lastly, in terms of outcome, depression is a treatable illness. If left untreated, people can go on to develop severe depression, leading to suicidal ideation, and also people ultimately committing suicide. Sometimes they may self-neglect, they may not go to work, and their life can be significantly affected. So try to treat your depression. Once depression is treated, you have to take medicines also for some time, and you may also need some additional counseling. So all kinds of help are available to come out of the depressive illness. But you need to ask for help. So if you feel low in mood, you need to talk to someone at home and try to get professional advice from a doctor or a psychologist, and they'll be able to help you. Depression, in some cases, they can develop depression for one episode, and on treatment they recover completely. But in majority of cases, depressive symptoms can actually come back. So it can come back after a few years, in which case we consider that as a second episode of depression or a third episode of depression and treat it. So many people are under the assumption that it never comes back, but only in some cases it doesn't come back at all. But in a majority of cases that we see, it has a tendency to come back, and therefore we treat them again. I hope you understood the symptoms of depression, what are the causes of depression, what are the treatment options available, and I guess that you found it helpful. Okay. Thank you so much.